Good morning, and welcome to the National Kidney Foundation of Indiana Kidneys Corner. I'm Dr. Wendy Kindig. I'm a nephrologist volunteering with the organization, and with me today I have Dr. Nancy Baird. Welcome. She's a nephrologist.
Thank you for having me.
You're welcome. She's practicing a clinician, so kidney specialist, that works with the Indiana Kidney Specialists group. So today we're going to focus in a little more on risk factors. Last time we talked about the screening program, and we try to select out those that are at high risk. So who's at high risk? And that's what we're going to focus on today. And then if you do have those risk factors, what do? Well, it's simply get screened. And the screening process can either be at one of our free screenings, or you can go to your primary care physician, because all you really need measured is your height and weight to give BMI, blood pressure, blood sugar, kidney function test, which is GFR, measured through creatinine. We talked about that last time. And also to check your urine for protein, or urine albumin excretion rate. So it's simply, so let's look and see who is it that needs to be screened. Since 1 in 3 of us are at risk for developing chronic kidney disease, and 1 in 9 of us have chronic kidney disease, and a lot of us don't really realize it. So there are a lot of risk factors, and I'm going to put those up on the screen. These are the risk factors that are most commonly talked about. So let's start with age. Dr. Baird, what is it about aging that seems to affect the kidneys in people?
Well, as the kidneys age, we see a decline in the GFR, which you've already discussed. Mm-hmm. We can, compounded by other factors, such as high blood pressure is more common with aging, and that can accelerate the aging damage in the kidneys, as well as other types of atherosclerosis.
Sure, and atherosclerosis, for those of you who haven't heard that term, generally just means hardening of the arteries, and we all tend to get some of that with aging, obviously. Exactly. Some more than others. Yeah.
And so with aging, we tend to get hardening of the arteries and some vascular disease in the kidneys. The other point with that is the people that are getting older sometimes also have to be a little more careful about some medications they might use that might cause an adverse effect on their kidney function, maybe even a little more than a young person might. Right, and that's why it's very important for your doctor to be aware of the kidney function and the GFR when they're prescribing medications, especially to the elderly. There may be some accumulation of certain medications that could produce further toxic injury to the kidneys.
Okay. So what about family history? You say, well, somebody in my family has kidney problems. Well, what are maybe some of the more common ones, or how does that happen? That people are, maybe certain kidney diseases run in family, or maybe there's just some risk factors within families.
That's correct. There are some hereditary diseases mm-hmm. that occur, the most common being autosomal dominant polycystic kidney disease, which we hopefully will have time to talk about later in this segment. And that runs in families. Most of the time people know if that is in their family. There's also types of other hereditary diseases that can cause chronic kidney disease. In addition, diabetes, especially type 2, runs in families, mm-hmm. And that can pose, can be a cause of chronic kidney disease, something to be aware of.
So some families there's a specific genetic pattern, and then other families there's a tendency. So
exactly.
So good to know your family history if somebody's had a problem with their kidneys in the past. That would put you at potential risk in the future.
Right.
So what about race? That's brought up a lot, saying that some racial groups seem to have it's more common for them to have kidney disease.
Yes, definitely. There are
There have been a lot of studies that show that African Americans have a higher risk for chronic kidney disease. They also, once chronic kidney disease is established, they tend to progress more quickly to end-stage kidney disease.
And do we know why that might be?
There are
not?
some genetic factors. There seems to be some genetic mutations that that they have identified that can cause more faster acceleration of kidney damage, and then there's other factors that we don't fully understand.
Is it felt that socioeconomic factors play any role in this or not?
Yes, there are, definitely lower socioeconomic status and poor access to medical care can lead to more chronic kidney disease because it's not identified and high blood pressure is not adequately treated.
Yeah.
Also, there's dietary factors that may play a role. That could accelerate the damage, especially if high blood pressure and diabetes are left untreated.
So it's probably a little difficult to sort out, probably some genetic factors or some hereditary factors and then also some environmental factors.
Exactly.
So what other groups are at higher risk?
American Indians that are at higher risk for chronic kidney disease. They are also at higher risk for diabetes.
So that may be a big factor.
Yes, so those things are factors, as well as high blood pressure.
And what about the Hispanic population? Because that's also another population that seems to have a little higher rate of chronic kidney disease.
Yes, they are also a population that has a higher risk. And once again, there may be some socioeconomic factors that contribute to later detection of chronic kidney disease, and therefore it may be further advanced when detected. So these are all good reasons to have early screening, and I know Dr. Kindig has discussed that in previous segments, how the National Kidney Foundation offers free screening.
Right. So there are some those are the common risk factors we think of, but there are also some additional risk factors that we wanted to look at today that maybe aren't as well known. So we'll have time maybe to talk a little bit about obesity, and then we'll talk about the others in the later segments. So what about obesity? How's that connected?
Well, obesity, especially BMIs over 30, have been associated with chronic kidney disease as well as proteinuria. Okay. So that would be protein in the urine, which is something believe Dr. Kindig talked about in an earlier segment, one of the things that we look at to identify early kidney injury. Yeah. There are also specific types of kidney disease that are associated with extreme ends of obesity, and we won't talk about that specifically at this time, but it also has been shown that metabolic syndrome is associated with protein in the urine and is felt to be an early sign of kidney damage, and then that can progress also over time.
We don't really have time to talk about the metabolic syndrome, but we're going to come back from the break and we'll be talking a little more in depth about some other risk factors.
When Margaret and I decided to sell the old estate here, we had only one choice in signage: Logan Street signs and banners. Conveniently not located on Logan Street anymore, but rather located on 10th Street on the south side of Noblesville. Well, we sold the old beauty, and we were able to buy this wonderful estate. And we had so much money left over, I was able to buy this beautiful 1968 Eldorado Cadillac for Margaret. Only 472,000 miles. Margaret loves it because it's got those big seats and that heavy-duty suspension to support her svelte frame. Next time you're looking for signs or banners, call old Jim at Logan Street Signs and Banners, 773-7200. Conveniently not located on Logan Street anymore.
Everyone knows it's easy to find first-run movies in the big theaters. But where can you go to watch your favorite classic movies on the big screen for the perfect night out? Why rent a flick when you can rent the entire theater? Call today to reserve our 32-seat theater for your next event, or just stop by to see what's showing this weekend. The 14 by 7 foot screen and the high quality digital surround sound system offers all the amenities you would expect from the big theaters, with a laid back atmosphere and comfortable seating of your own home. Wofford Theater at 1744 South 10th Street in Noblesville gives you the classic movies you want with a big theater experience.
Welcome back. This segment we're going to be focusing on adverse effects of smoking on the kidney, which is not something we commonly think of with smoking. We always think about lung cancer, chronic lung disease, a variety of other health issues, but not so much the kidneys. So I'm having Janet Gafkjen join us in this segment. Welcome, Janet.
Thank you very much.
She's the director of Partnership for a Healthy Hamilton County, and I think I'm briefly going to have her tell us about that organization so you know.
Well, I thank you both for being here today. And the Partnership for a Healthy Hamilton County has been created out of a collaboration with our healthcare providers in Hamilton County. That would be our 5 hospitals: Riverview Health, Community Health, St. Francis, St. Vincent, and and Riverview Health and IU, yes. So they gathered together when they did a health needs assessment and determined that there were priorities within the county that we could collaborate with all of the partners throughout the county. And so in January, we started off and have gone throughout the county to try and look at low cost or no cost initiatives to help our 3 priorities.
Okay. All right.
So I'll let you start.
Okay. Well, we'd like to find out a little bit more about the medical aspect of smoking in the kidney. So I'm going to have Dr. Baird address that. And if I get to the right slide, there we go. So anyways, Dr. Baird, how is it that smoking can affect the kidneys?
Well, tobacco definitely causes vasoconstriction in the kidneys. Studies have correlated certain types of kidney injury with smoking. And so it does cause a more rapid acceleration once chronic kidney disease has been established with certain types of injury from tobacco use. In addition, it has been shown to affect if someone goes on to need a transplant, has been shown to be associated with more rapid loss of the transplanted kidney. So we do definitely recommend smoking cessation before any type of kidney transplant evaluation.
Okay. Now, you use the term vasoconstriction, so for the audience out there, that means tightening down or narrowing of the blood vessels. And that seems to be mediated through, and nicotine is probably the major factor in this, it tends to cause release of what's called catecholamines within your body that then cause this effect on the blood vessels. So that's probably part of that mechanism. So obviously, nicotine addiction is a tough habit to break. And I thought it would be worthwhile having Janet here today to talk a little bit about kind of what they're working on in the county in terms of both prevention. That's the best thing. If you don't ever start, that's much easier than trying to stop. But then also what's available for smoking cessation. So Janet, tell us a little bit about what you're up to.
We actually are quite excited because in Hamilton County, we received a grant from the Indiana State Department of Health to work towards increasing the awareness and education of people on, as you've mentioned before, all the different systemic things that can happen throughout via kidney, diabetes, all these things, and what the effects of nicotine does. We have seen that we do actually have a decrease that is continuing in the county from smoking, but we still have a higher, as a state, we're 7th in the entire rankings as far as smoking. And so we still have a ways to go to decrease that. We are working with initiatives to decrease the amount of the adult smoking, as well as maintain middle school. At the rate they're at about 5% of smokers in middle school. And so we want to maintain and then also decrease, and then also within the high school population we are seeing an increase. And when you mentioned nicotine, that was another aspect or component that we now have with the e-cigarettes and the liquid nicotine that, again, we realize it as being an addiction, and it also does have effects on kidneys and other systems. So we are trying to work to raise the awareness of both parents and students of what are the consequences of it, or what aspects of that, and how not to start. So we have a youth coalition that we're working with. We also are having our first kind of inaugural coalition meeting where we have upwards of 50, 60 partners in the community that will begin to help us to disseminate this information, help with the awareness of it, and the
So in
effects.
other words, part of what you're saying too is that vaping is not really necessarily safe. It might be useful as a tool to help in people getting off cigarettes, but as far as just saying, hey, this is a safe thing to do, it probably has its own issues and may be problematic in
And
the
we
future. And maybe it looks like also a factor in getting more young people to begin switching over from vaping to cigarettes.
Correct. And again, we don't know all those outcomes yet as to what does vaping do and how is that effects of it, but it is an addiction as far as, so it may help others to decrease that and move away from cigarettes. Others will begin, and that's what we're trying to say is let's look at those options and what can we do to help to say don't start.
Yeah.
Be it a tobacco product or a liquid nicotine or vaping product.
Yeah, and I guess I didn't realize some of the marketing techniques, since they can't have commercials on television. I think one of your associates was telling me that just you go into a convenience store and they have everything set up at children's eye level with, fancy wrappers and things that would attract their attention and all kinds of tools to try to get people interested in giving it a try.
It's that curiosity when you have a packaging that says, here's 2 grape, and they will call them, be it a cigar or a cigarette, because it's wrapped in a tobacco leaf and not white paper, therefore it's not a cigarette. So, but it's you look at it and you go, oh, I wonder what that's going to taste like. And it's very, those flavors, they've moved through tobacco companies looking at candy makers to say, what are your popular flavors
How can
that
we
you do
this to-
so that it is one that it is marketing toward a younger
So parents just
population.
need to be aware of those
It's
techniques.
surprising as
Yeah.
a parent to really see what's out there and have that introduction. So we hope to be able to do that with the grant monies and also engage policy changes to continue to work. Not only do we have the beginnings of the tobacco, but we also are working with secondhand smoke.
Sure.
And the effects of that as well.
So now, for those that are already addicted or they're already smokers and they're really trying to get off, what's available in Hamilton County for those
We are
people to do?
working very strongly with healthcare providers as well as to introduce and help to make referrals. We have 1-800-QUIT-NOW is the quit line. They are really working there are professionals there, behavioral specialists, and are working very much with the lifestyle to say, if you need a text message to get encouragement to support, they can work with text to quit. They can do with phone calls. We can work with emails. They are really trying to work with people to help. And just to say, 56% of the people in the state of Indiana, 56, 58, have tried in the last year to quit. But it's difficult. So what we want to say is try again. Here's another opportunity to kind of work. There are coaches out there and available, and we're hoping to kind of help work with that.
So remember, www.quitnow.com or 1-800-QUIT-NOW. And that's, I think, all for this segment. So we're going to be back in the next segment to finish up some of the risk factors in our last one. Thanks.
When Margaret and I decided to sell the old estate here, we had only one choice in signage. Logan Street signs and banners. Conveniently not located on Logan Street anymore, but rather located on 10th Street on the south side of Noblesville. Well, we sold the old beauty, and we were able to buy this wonderful estate. And we had so much money left over, I was able to buy this beautiful 1968 Eldorado Cadillac for Margaret. Only 472,000 miles. Margaret loves it because it's got those big seats and that heavy-duty suspension to support her svelte frame. Next time you're looking for signs or banners, call old Jim at Logan Street Signs and Banners, 773-7200. Conveniently not located on Logan Street anymore.
Everyone knows it's easy to find first-run movies in the big theaters. But where can you go to watch your favorite classic movies on the big screen for the perfect night out? Why rent a flick when you can rent the entire theater? Call today to reserve our 32-seat theater for your or just stop by to see what's showing this weekend. The 14 by 7 foot screen and the high quality digital surround sound system offers all the amenities you would expect from the big theaters with a laid back atmosphere and comfortable seating of your own home. Wofford Theater at 1744 South 10th Street in Noblesville gives you the classic movies you want with a big theater experience.
Welcome back. We've been focusing on risk factors for the development of chronic kidney disease today, and we just got done with the smoking part, and we're going to move on. One of the other things that's a common potential problem is the use of over-the-counter medications, and these are the non-steroidal anti-inflammatory drugs. So Dr. Baird's going to help us a little bit with this to understand what the issues are and a little bit more about the availability and how you would find out or how you're monitored, that sort of thing. So tell us a little bit about medications that can be a risk for kidney problems.
Well, these medications, the non-steroidal anti-inflammatory agents, are readily available over the counter.
So such
as Advil, Aleve, Motrin, ibuprofen. Most of them are an ibuprofen, the over-the-counter medications. Also, naproxen is available over the counter, and excessive
can
use.
you get these also by prescription?
Yes,
or?
and they're also prescribed, often in even higher doses or stronger doses by prescription. And so they're often prescribed for various musculoskeletal ailments
Well, I can just think
or
of-
arthritis.
Yeah, I mean, I can just think of even people that are out, strain a muscle doing something. Well, what do I grab? I grab an ibuprofen, or I've out and done something, and I've just played a game of volleyball, and I'm not used to playing, and I pulled something. So what do? I go grab some non-steroidals. So is that?
And generally, that's safe to use it on a short-term basis. That's what they're really designed for, is use on for short-term use, the over-the-counter agents. However, chronic use of these agents, that unsupervised, I should say, chronic use of these agents, can cause a variety of kidney injury, and it can cause an acute or sudden change in the kidney function, and it can also cause some chronic damage to the kidneys when
Now,
used over long periods
would
of
people
time.
that are using it, would they have any warning or symptoms or signs of that or not?
Sometimes they can. The most common thing would be an aggravation maybe of high blood pressure. If you already have the high blood pressure, you might see a rise in the blood pressure. You might also see some swelling of the feet and ankles.
So these
or around the eyes. That would be a sign of kidney injury from these type of agents.
So these drugs can cause salt and water retention from the kidney.
Yes.
Aggravate a blood pressure problem and cause
Aggravate
swelling.
blood pressure, cause swelling, fluid retention. Those would be some of the symptoms that the patient would see, signs and symptoms that the patient would see.
So what else can these drugs do?
And then they can cause other forms of more silent kidney injury. You can see an abnormality of the GFR, or kidney function. You can also see protein in the urine. These are signs that you may be exhibiting injury from these agents. And so if they're prescribed, then it's usually monitored by your physician. If they're over the counter, this might not be adequately monitored.
So just for the general audience out there, then if somebody says, well, hey, I use this, intermittently, but I don't use it all the time, at what point or how do they need to be monitored? Should they say, well, if I want to use this for more than a week, maybe I should go see my physician and make sure I'm not at risk for problems or that everything's okay?
I would
Or-
definitely recommend that. If you're needing it on a chronic basis, maybe over a week on a sustained basis, it's wise to have that monitored by your physician.
And then I think the other thing which you kind of mentioned is if you already have a chronic kidney disease or you have diabetes, high blood pressure already, you already have risk factors, so this may just be one more thing on top of it that may give you some difficulty.
Yes, and also the elderly are at greater risk for
Side effects.
the side effects from nonsteroidal anti-inflammatory agents. And unfortunately, they're really the population that needs it more also
Oh, sure.
because of arthritis.
A lot more aches and pains.
So, yes, so if they're needing it on a chronic basis, it should be monitored by their
Okay.
physician.
Okay. Well, now we're going to talk about, we talked about family history being important as a risk factor, and there is one inherited disease that's relatively common that we did want to talk just a little bit more about. So Dr. Baird, what is that? And
Well,
tell
we
us
were
a
going to
little more
talk a little bit more about autosomal dominant polycystic kidney disease, which is a common disorder. It affects 1 in 400 to 1,000 births. Only 50% of people are diagnosed. So if you
And
do
what-
have a family history of chronic kidney disease or someone in your family needing dialysis, it's good to be aware of that. It is there are different chromosomal abnormalities that can cause this.
So let's say one of your parents had this, and there's 4 of you kids. What would be the odds of the children having this?
Each child is at 50%.
So 50-50, flip of the
50,
coin.
50 for each child. Yes.
So it's a dominant trait. It's not recessive where there'd be less chance of that. So 50-50 chance.
That is
Okay.
correct.
Okay.
That is correct.
And so the 25% that you say have no family history, is that because this is a mutation or something that's just popped up or
Right.
don't really know or?
We don't know, but it's thought to be a spontaneous mutation
Okay.
in 25%.
And I guess maybe the other factor is sometimes it occurs a little later in life, so the children may not, or if the patient's or the person's not aware and they have kids that are already growing up an adult, they may not, if it doesn't have a rapidly progressive course, they might not know. So what we say polycystic kidney, what happens to the kidneys?
Well, the kidneys are eventually filled with cysts, so fluid-containing sacs.
Okay.
I often describe it as blisters on the inside of the kidneys.
Okay.
So you can think of it as a fluid-filled sac.
Okay.
And eventually they become more severe as time goes on and can occupy the normal tissue in the kidney and lead to chronic kidney disease or other high blood pressure, and there are some other complications. It can cause progressive loss of kidney function.
So if you have a family history of kidney disease, especially maybe cysts in the kidney, you may want to be evaluated. And this would take a little more than just the urine and the blood pressure and the GFR. This requires ultrasound or something to x-ray the kidneys to look for those cysts. And the number of cysts and there are a variety of parameters that can be looked at to tell for sure. And you wouldn't probably do that till you're an adult or a young adult anyways.
Exactly.
Yeah. So
Usually presents in the 4th decade of life, so in the 30s or 40s.
Okay. Okay. Well, thank you, Dr. Baird.
You're
Just
welcome.
wanted to put up our next screening event is going to be in Evansville, so the Indiana Kidney Check free screening program is there.
And then on November 14th, we have Too Sweet for Your Own Good. It's a diabetes conference open to anyone at IU Fairbanks Hall. So that's going to be it for today. Here's our contact information if you have any questions or comments. And we'll be back next month. See you then. Yeah, we only